Thank you for having me. I really enjoyed the last presentation. I wish I had that opportunity to go there. It was such a beautiful program. But anyway, this will is sort of related to mom and child. So this is my I'm a PhD student.
Rebecca, we are seeing your speaker notes. You had to.
Oh gosh.
I think you click swap displays on the top. I think that's what you need to do. Try that.
Is that?
Yeah, you got it.
Thank you. So I'm a PhD student. And this is my dissertation. I'm currently still looking for participants until the end of October, or until 7 more people participate, whichever comes first. And I also just wanted to share some of the results. The study has been funded through these different places, and these are my committee members, and my chair is Dr. Hudson Santos. So I'm originally from Mexico City, where this picture was taken, a really old picture of my family. I moved to the United States when I was 9, which is why I'm interested in looking at this through like migration through the lens of family and generations. So a quick overview of the background and the purpose of this study. So children of Latin American immigrants tend to have worse health than their parents. There's nuances, but for the sake of time, they're primarily conditions like asthma, obesity, emotional health. When you put the puzzle pieces back, these conditions are associated with chronic stress and inflammation, and they're more likely to happen in subgroups that report more discrimination. So at the bottom part here, I've been using my advisor's data to look at these different pregnancy outcomes for Latinas that grow up in North Carolina compared to immigrant Latinas that come here as adults. So it gets worse for all these things you see here: birth weights, mental health, reporting more discrimination, and inflammation. So inflammation tends to be the result of immune stress response dysregulation that begins in childhood. So for this study, what I've been wanting to look at is this early childhood period, not just retrospectively, like where did you grow up, but concurrently. So if health disparities really do begin at this period, then what is happening? What is the role of different stressors or supports, or the place where you live, and how is that influencing the health of our community, especially during this sensitive developmental period when we can prevent social inequities in health? So the purpose is to identify community needs and potential consequences of not addressing those needs. So I'm collecting data that can hopefully inform and fund programs to advocate for policies that strengthen families. So far, so where are participants from so far? So how dark blue it is means more people have participated in this study, and gray is nobody yet. Although it's necessary to acknowledge that we're not like a monolithic group, it's also important to find common experiences post-migration, especially for the practical purposes of informing programs and policies. So as far as I'm looking at where people live, because that also tends to shape post-migration trajectories and health. So one of the measures I'm using is the Child Opportunity Index, which is looks at neighborhood conditions for child development, like Are there places to play? Is there healthy food available? What are the schools like? That is in addition to neighborhood poverty. So in North Carolina, 53% of Latino children live in the low opportunity neighborhoods, compared to 27% of white children and 61% of Black children. So in this study, like 40% live in the neighborhoods indexed as low opportunity. So there's like a little shift compared to North Carolina in general, and that's because Wake and Orange County is pretty heavily in the high opportunity neighborhood, and also in the material education here ended up a pretty good curve where people are represented. So for the prevalence rate so far, so the first question is pretty much, it's a 10-question scale. So this 3 out of 4 moms reported worry about discrimination, which would be endorsing 1 question out of the 10, and then the rest are based on 1 question. So almost half worry about loneliness and isolation. 1 and 2 worry about never seeing a family member again. And this one was interesting because it's also not just endorsing worry about it, but the most amount of worry. I think we all know about the dentist situation, experiences of discrimination. So for each one of these, 1 and 2 in the past year reported being treated with less respect, less courtesy, worse service. And this is from a social support scale. I pulled out the emotional informational social support because that one had the of the social support had the strongest relationships. So yes, if you have more family stress, like here, you have less social support. But the strongest predictor of having less social support was actually living in a neighborhood with lower opportunity. And in turn, moms that report less social support are more likely to have obese children and children with more depressive symptoms. So based on this data, the more language barriers you have, the less social support you have, but then the more you speak English, the more people tend to report these experiences of discrimination. And that's a pretty common finding, which is why I also included the worry about discrimination, because that doesn't have a relationship to English. Also, since these are in-person studies, like a lot of times I get a lot of commentaries or stories, or so it like all that background information helps with finding how the experiences connect to each other. As far as emotional health, these is reported for the mom in the past 2 weeks and for the child past 2 months. So this is really high for a community sample. I know that the pandemic kind of had a influence on adolescent health. So in general, 1 in 4 moms screen positive for major depression. 1 in 4 children for internalizing disorders. So in general, all the stressors are associated with the mom. Sorry, yo soy una llorona, perdóname. Lloro de todo. But anyway, county rurality was the strongest predictor of discrimination, worry about discrimination, and depressive symptoms. So this is regardless of how much English the mom speaks or her educational levels. Okay, so that, and I don't have the inflammation data yet, which is the immune dysregulation data, which I won't have until I finish. So what is it measuring? It's measuring inflammation. So the reason for that, it's because as a result of chronic stress, it increases in the second generation, and it's related to childhood experiences. And also it underlies a lot of the chronic health conditions that you see. So instead of looking at the end biological data, like the end product, like cortisol, which is like probably the most like commonly looked at in childhood, I want to look at the source, which is why I have the little faucet. That I'm looking at like the knob rather than what actually finally comes out. So in order to do that, I'm looking at DNA methylation of immune-related genes. So usually when people think of DNA, they think of like 23andMe, like ancestry, who you're related to, risk for disease based on genetic factors. So that would be genotyping. This is not at all what this is. So I'm going to be completely clueless about those things because that's not what I'm looking at. So what I'm actually looking at is the degree to which specific genes have been turned on or off based on your life experiences. And as you get older, some of those knobs that turn your gene on and off get a little bit stiffer. So you lose that biological malleability. So in some ways, it's like a biological record of your experiences. And if anyone is interested in epigenomics, this is the link to it. So the end of the questionnaire is, what do you like most about your child? And I like looking at it. It's so I pulled this out. I thought I do the dissertation, but I kind of like looking at like what people answer. I put everything here because usually if I'm reading the questions, that's what people will say before they narrow it down. But it's interesting that the children get appreciated for who they are. Like someone would say fearless, and then it's like calm, responsible. Or one child plays well, plays well with children at parties, and someone else will plays alone well. So it's like you see these multi-facets of it. So this is a flyer. So what it consists of is it's generally a home visit, but it can be anywhere, since some people probably don't want me showing up at their doorstep. So I would say 90% has been home visits. Others has been library, restaurant, and somebody else's house has been after that the most popular. So it's tons of questions, a saliva sample of the mom of the child, height and weight measurement of the child. And then afterwards, the mom gets a $25 gift card from Walmart and a small gift for the child of like age appropriate toys. And these are like maybe more specific, like being born in any Latin American country, living less than an hour from Raleigh or Chapel Hill, since it's a home visit. Someone told me that coche was a stroller, so I was like, oh, I better put all of them. This is so one of my little participants drew a picture of me, and it was really flattering. I was like, oh, I hope she gives it to me when she's done, and she did. So that's it. So I was just presenting the work just so people could see what is available so far of results, and also because without the help of other people, I would have like no participants because nobody responds to flyers. It's mostly tagging along at community events with Dr. Villegas and going to the Mexican consulate and other moms, like social networks, telling each other about the study.